My name is Dr. Dalsy Wanda. I'm a clinical and radiation oncologist. That means a doctor who treats cancer using chemotherapy and radiotherapy. I've been asked several questions about anemia, and I felt it would be a good time to discuss anemia, talk about some of its causes, symptoms, and how to manage anemia, and even prevention. So, what is anemia? So, anemia is a situation where a person does not have enough red blood cells that are healthy in circulation to enable them carry oxygen efficiently. So you'd find a patient does not have enough red blood cells, or the red blood cells are abnormal. So in such a situation, you would notice the patient would have certain symptoms like some headache, lower limb swelling, the legs could swell. They could also have shortness of breath. Fatigue is also another symptom of anemia that could happen. If you look at their palms, you'd notice perhaps they're light, especially in light people. You'd notice there's pale. You'd see it's a bit pale if you compare with someone else. Their hand is a bit pink or red, and that person's is white. If you look at the eye, you pull the lower lid, you'll be able to see that area is pale, so meaning lighter than what other people look like. And even the tongue, you'd notice that it's a bit pale. So when we talk about causes of anemia, they could be almost threefold. One, when the body is not making enough red blood cells to deal with the needs of the body. Two, when the body is breaking down the red blood cells too fast. And if you're losing blood, maybe you're bleeding, that could cause anemia. And the bleeding could either be rapid, maybe you've had a cut or you've been involved in an accident and you bleed out, or it could be chronic in terms of you're bleeding slowly over time. Anemia, when it starts, there might be no symptoms that are very overt, especially when it is mild. Most people get symptoms when they have gone maybe 3 or 4 levels below their normal. The levels of anemia or hemoglobin for men is higher, so we expect men to have a HB of around 13 and above. For women, it's acceptable from around 12 to 14, so it's lower, just because we lose blood every month due to our menstrual cycle. So when we talk about types of anemia, there are different types. There are some that are iron deficiency. So if you're not taking in iron, there are many sources of iron that can be plant-based. The legumes can be sources of iron. And we have the animal-based, which is the meat, the fish. That's a source of iron. So when it's iron deficiency, it means you're not taking in enough of the iron, or your body is not absorbing the iron. The other vitamins that are important in making red blood cells, which is vitamin B12 and folate. So when you do not have folate, then your red blood cells become large. We call that folate deficiency. And when we measure the size of the red blood cells, then you notice it's a big red blood cell, which compromises its ability to carry oxygen well. Then there are other causes of anemia that can be there, that could be hereditary. For example, sickle cell anemia, thalassemia. Those are types of anemia that can be genetically passed from one person to the other. Chronic conditions like ulcerative colitis, which is a problem in the gut, in the large gut, where you have ulceration, means you can bleed over time for long. Other inflammatory processes or infections that affect the bone marrow can make the bone marrow unable to make red blood cells. And that can happen in situations like aplastic anemia, where the bone marrow does not have cells, all of them. So be it the red blood cells, the white blood cells. So the stem cells that produce these cells, you find they are not operating, they are not working. When you look at the bone marrow, you find it has either hypoplastic cells, very few, or sometimes none at all. Aplastic anemia can happen because of exposure to chemotherapy. Aplastic anemia can happen because of exposure to certain viral infections. Radiation can cause aplastic anemia. And sometimes we really don't know what, because even some infections can cause aplastic anemia. And the treatment for aplastic anemia can be very varied, including treating the cause, be it an infection, supporting the marrow, and even goes all the way to sometimes bone marrow replacement to see whether you can put back the stem cells to make the marrow functional. The signs, like I mentioned, is fatigue, very tired, you're not able to move as fast as you moved before. Palpitations, maybe you feel your heart is beating faster than it was before. You notice your lower limbs are swelling. Those are some of the symptoms that you may notice. You have a headache. Those are symptoms. And then when the signs is the ones you mentioned, the pale palms, pale sclera of the eye, the tongue, when you look at it, it's low. And then when you feel the pulse, you might feel that the pulse is a bit raised because it's trying to compensate. And shortness of breath, because you're trying to breathe faster so that the cells can get enough oxygen. So how do we prevent anemia? It's very important to check our diet. We have to make sure our diet has iron, because we said iron is the protein that makes hemoglobin, and hemoglobin is very important in carrying of oxygen. We need to make sure we are taking diet that has vitamin B12. If we do notice we have deficiency or inability to absorb, which is called pernicious anemia, then we need to supplement how we get the vitamin B12 in the body if we are not able to extract it from the food we take. So some of the foods that are rich in iron include beef, beans, lentils, iron fortified cereals. We have dark green leafy vegetables and even some dry fruits. When we talk about folate, we're talking about some fruits. We're talking about dark green vegetables. We're talking about beans, some peanuts, enriched grain products such as grain, cereal, pasta, and rice. When they're enriched with folate, they can be able to help. And even green peas have been known to have folate. Vitamin B12, meat has vitamin B12, some dairy products, and also when cereals are fortified with vitamin B12, it really assists. Vitamin C is also important in absorption. And when you talk about vitamin C, then you're talking about citrus fruits, juices, peppers, broccoli, tomatoes, melons, and even strawberries. And those are rich in vitamin C. And that's really important to take in the form of the diet because it helps you prevent. The other is secondary prevention. If you do notice that you have anemia, we want to know which type. Is it the iron that is low? Is it the folate that is low? And if we notice it's the iron, then we are able to supplement with iron, either in the form of a tablet or a syrup, just to boost your intake of the iron. If it's folate, then there are tablets that can be used to boost your folate levels, or an injection of vitamin B12 can be given monthly if we notice absorption is the challenge. If we notice that you have a plastic anemia, then that needs to be addressed because it means the bone marrow is not working as it should be. If you're pregnant, it's very important for you to take your supplementation. We do know pregnancy is a risk factor to anemia because you have increased needs, increased oxygen demands that need more hemoglobin so that the baby can be able to get oxygen. So for pregnant women, what we offer is supplementation, and it's in the form of a tablet they're supposed to take every day. I know many women don't like the taste and sometimes default from it, but it's very important because if you're anemic in pregnancy, one, it means your baby won't get enough oxygen. Two, it means the chances of complications during delivery are higher because you lose blood during delivery. So if already your blood level was low, then that becomes a challenge in terms of management. The other thing is if you notice your menses are heavy. By heavy, you mean you're changing more than 2 pads in a day that are fully soaked. So that's about more than 200 mils per day. Then that means it's heavy flow. So if you're having heavy menses, it's good for it to be looked into. Are you having fibroids? What is the challenge behind it? The other thing is if you have ulcerative colitis, which we said is a problem in the colon, where you have ulcers that are bleeding, then it's good for that autoimmune problem to be treated so that you don't continually lose blood. Then if we notice that you have a hereditary problem like sickle cell, then there's what we also do to reduce the crises that you have to ensure that your anemia is kept at check. So there are various ways we address anemia. For example, if the problem is that you have a chronic kidney problem where one of the hormones called erythropoietin is not working well. So those who are undergoing dialysis, because it's a chronic condition and erythropoietin is low, and that erythropoietin is what stimulates the bone marrow now to make red blood cells. So when that happens, then what we encourage is that every week the patient gets an injection of erythropoietin. So there are several stimulants for the marrow. We have erythropoietin, we have dabapoietin, and these are different stimulants. Their role is to tell the bone marrow, make more red blood cells, make more red blood cells. We have increased needs, and that can be used to stimulate. If iron is the challenge, we can give you infusion, even through the vein, iron supplementation. And for those who are interested, then anemia, when severe, can be managed by other mechanisms. But that's what I wanted to talk to you about anemia. So prevention is easier. you can always ensure your HB is high. It's good to know what your HB is now. There are certain people who go for the first time for the test and discover their HB is 5 or 6 and 7. And that will be the trigger to want to find out why. The other thing, it's very, very important for you to deworm. Having infestation of worms has been shown to reduce HB. Remember, the worms are in the intestine, in the gut. They cause microabrasions, so it's very possible for your HB to be low. So guys, please make sure you take your deworming every 3 months. It's not just for children, it's for adults too. And make sure we are checking that out.